Good morning. Today we are going to talk about infant death. Okay, let's proceed. So, why is infant death so important to us? It's so because while doing autopsy in infanticide cases, we want to know whether the child born was stillborn or dead born. Okay, or was the child born was alive? That is, we want to differentiate live born, stillborn, and dead born. And if the child was born alive, then how long did he survive after birth? And what was the cause of death? So these are some of the medical legal questions that arise uh, during the infanticide cases. So coming to the definition of infanticide is it's unlawful destruction of a child below the age of 1 year by anyone. Okay, it does not include the death of the fetus during labor or when it is destroyed by craniotomy or decapitation. So, infanticide, the death of the child has to occur within a span of 1 year or less than 1 year by anyone, and it will not include craniotomy or decapitation, or the when the death has happened during the process of labor. Okay, so these are some of the exceptions. Now we move to the next definition, that is feticide. What is feticide? It is the killing of a fetus at any time prior to birth. So, whenever a fetus is killed before the birth, for example, in prenatal sex determination, and you come to know that the fetus is a female fetus, following which abortion is underwent by the female or is forced to undergo abortion. That cases are some of the examples which is covered under feticide. Next is neonaticide. So what is neonaticide? It is killing of an infant within 24 hours of birth. So infanticide is when a child is born, but the death happens within 1 year. Okay, that is infanticide. Then we have feticide. Then prior to birth, when a child is killed. Then we have neonaticide, that is killing of an infant within 24 hours of birth. Whereas this neonate term in obstetric is used to donate an infant up to 28 days after birth. But since here in forensic medicine, it is considered as killing of an infant within 24 hours of birth. Psychiatry and forensic medicine, killing of an infant within 24 hours of birth is considered as neonaticide. Next. Now we have yet another term, that is filicide. What is filicide? It is the deliberate act of killing of a child by parents. Okay. In other countries like Canada, UK, Australia, Italy, the murder of a child who is less than 1 year of age by his own mother is not considered as homicide. And she is charged with a less offense of infanticide, that is post, for which punishment is lesser. Okay, like postpartum depression or baby blues. But in India, nothing of such sort is considered. There is no distinction between murder of a newborn infant or murder of any individual. Okay, so the punishment for both are same. Now, what is stillborn? Since we are seeing some of these definitions, yet another definition is a stillborn. Who's stillborn? A child who is born after 28 days of pregnancy and which did not breathe or show any signs of life at any time after being completely born, as per WHO. So, as per WHO, a child who is born after 28 weeks of pregnancy and which did not show any other signs of life after being completely born is a stillborn child. Okay. Now, the features: the child was alive in utero but dies during the process of birth. Okay. In utero, the child is alive, while during the process of birth, the child dies. That that is considered as a stillborn, and it is more common in illegitimate or immature male or in primipara females. Okay. The incidence of stillborn is 5%, and the causes can be any of these, like anoxia, birth trauma, congenital defect, erythroblastosis fetalis, placental abnormalities, prematurity, and toxemia of pregnancy. Now we'll come to another definition, which is deadborn. So, what is a deadborn? A deadborn child is one which has died in utero and shows one of the following signs after it is completely born. That is maceration, rigor mortis, putrefaction, and adiposia. So, dead birth is a child is considered to be a dead born child if he has died in utero and shows following signs. After it is born, it shows the signs of maceration, rigor mortis, putrefaction, and adiposia. Okay, and mummification. So, these five signs are seen after the child is taken out of the womb. He is showing the signs of maceration, rigor mortis, putrefaction, adiposia, and mummification. Next, we'll see the difference. What is the difference between a stillborn and a deadborn fetus? So, in stillborn, the period of gestation has to be more than 28 weeks, whereas in deadborn, it is the period of gestation can be at any time in utero. Okay, the conditions in the uterus was alive just before start of labor pain, died during labor in birth canal, and did not show any signs of life after being born. Whereas in deadborn, it was lying dead in uterus. Okay, so it was alive in uterus during the process of labor in birth canal, did not show any signs of life. That is a stillborn fetus. The predominance is in a stillborn seen mostly among illegitimate and immature male child in primipara. Okay, whereas in deadborn, no such predominance is seen. Cardinal features of stillborn are signs of prolonged labor, bleeding into skull, caput succedaneum, edema, severe molding of the head. Whereas in deadborn, any of the following signs can be seen. That is maceration, mummification, rigor mortis, delivery, and some of the radiological signs that we'll see later. And the causes can be anoxia, aspiration, birth trauma, prematurity, strangulation on cord, and toxemia. Whereas in deadborn, it can be congenital anomaly, APO, and RH incompatibility. Okay. So now we move on to the next topic, that is post-mortem examination of infants. If such child is brought for autopsy, how you going to proceed? First, the whole body radiograph, that is anterior, posterior, and lateral view has to be taken. And then photograph of the external features like the frontal picture of the entire body and close-ups of the face and side of the head as well as any other unusual aspects are taken. Now, external examination. So, clothing and wrapping should be examined for identification. Then, head, chest, and abdominal circumference should be noted down. Then, length, that is crown rump and crown heel length, and foot length has to be measured for the fetus. Weight of the baby helps to assess the gestational age. Then, distribution and quality of hair over the head and rest of the body are noted. Then, fontanelle dimensions are measured. And then configuration of the ear is examined and plasticity, okay, indicating the amount of cartilage. So these are some of the external features that you will see. If you wrap up, what are those? Clothings, then the circumferences of the head, chest, and abdomen, then the crown rump, Length, the crown heel length and the foot length has to be taken. Weight of the baby has to be noted down. Then the hair distribution throughout the body and the head has to be noted. Then fontanelle dimensions are to be measured. Then the configuration of the ear has to be examined. So this picture just shows um, the various measurements that we take. So this is the head circumference, this one. This is crown to rump length. This is crown to heel length. And this is the abdominal circumference. And this is the internipple distance. Okay. This is the biparietal diameter. Okay. And other things that has to be noted down are facial features are examined and noted, and distances between the inner and outer canthi has to be noted down. Inner canthi distance, outer canthi distance. Then color of the sclera iris, relative size of the pupils, color of the conjunctiva has to be noted. Abnormalities of the shape of the head related to molding, trauma, soft tissue edema, hemorrhage, autolysis has to be noted down. Then what are the changes of putrefaction? So the changes of the putrefaction, that is decomposition, it helps in asserting the time since death first. Then the bodies of the newborn infants are normally sterile. When they breathe and swallow, microorganisms enter into the body. So stillborn putrefaction occurs from outside to inside, and in liveborn from within only to outside. And decomposition must be differentiated from maceration, which is a sure sign of a dead born fetus. Then presence or absence of Wernicke's caseosa, that you see the whitest that is covering the whole body of the baby, that is the Wernicke's caseosa. Presence of Wernicke's caseosa is not as useful sign, but still you have to note that finding also. Um, and absence will indicate that the child had been washed, suggesting that it survived for some time after birth. Now, placenta you have to check. That is, weight of the placenta has to be taken, and it has to be evaluated for maturity, and any abnormality should be observed. About 15 to 20 centimeter, it should be at least 15 to 20 centimeter in diameter. The central thickness should be 2.5 centimeter, and weight of placenta at term is 500 grams. Now we have umbilical cord. So how do we proceed with examination? We have to cut end of the cord should be looked for vital reactions. Okay. Then whether it was actually cut or toned or any abnormal twist and knots or any infection has to be noted down. And a cut which is made by a sharp instrument like scissor or knife will appear clean cut. And rigid, if the instrument is blunt, the appearance will be like rigid. All the injuries and bruises, particularly around the mouth, nose, and frenulum, should be noted, and swab should be taken from every orifice, as if it were a case of sexual assault. Okay, so this was the examination of the umbilical cord. Previously, we saw the examination of the placenta. Now, the dissection of the head. In newborns and infants, different approaches are made for the removal of the brain. Okay, there are two methods that we follow for opening the head of an infant. Okay, we'll see that. One is Benke's technique. That is, it opens the skull in two flaps, and you have to check for any caput succedaneum formation or any caput formation, width of the suture, size of the fontanelles, degree of calcification, any separation of the occipital plates caused by the birth trauma, incision of the atlanto-occipital membrane will reveal tonsillar herniation and posterior fossa hemorrhage, and a sample of CSF from the cisterna magna can be removed if necessary using a sterile needle. The removal of skull, the cutting along the suture lines will destroy the falls and the superior sagittal venous sinus. Cut is made about zero point 0.5 centimeter on either side of the sagittal suture. An incision from the anterior fontanelle at its posterior margin, about zero point 0.5 centimeter on the right side of the midline. And the incision will cut both the dura and the skull together. Okay. And after an incision of about 2 centimeter, introduce one end of the heavy duty scissors inside the skull and cut posteriorly up to point B and anteriorly up to point C, and right side of the skull to come out like a flap, like BAC. Now, whatever is written here, how it is done, we'll show in the next slide. Okay. So this is the Benke's techniques. We are opening it in two parts. Okay. Then this is the Bar's technique. Okay. This is the side view, and this is the top view. Okay. Like four flaps will be taken. One, two, three, and four. Open, so Bar's technique, it opens skull in four flaps, like butterfly ring. Okay. Now, other structures that we will see are in the neck, we'll see for any internal injuries, and trachea for any foreign body. Thorax, will before opening the thorax, the abdomen is opened first. Okay, and position of the diaphragm is noted by passing a finger. The whole chest cavity can be opened underwater to check for pneumothorax, and Latule's technique, that is en masse removal, is the most preferred method in all the cases. Free blood or fluid or pus or stomach contents present in the thoracic and the abdominal cavity is noted, and whether the diaphragm is ruptured or not has to be seen. Then the limbs and the sternum. Here in the bones, we check for the ossification center to determine the age of the fetus. In Talus, ossification centers appears at 7 months of intrauterine life. Calcaneum we see 5th month of intrauterine life. Lower end of femur we see in the 9th month of intrauterine life. Lower end of tibia we see at birth. Okay. So these are some of the ossification centers that helps to determine the age of the fetus. Now, what is maceration? Maceration is originated from the Latin word macerate, to soften by soaking. It is a degenerative changes occurring in a fetus retained in utero after birth due to softening effect of soaking on solid body, that is pulpy fetus. The salient features are: the earliest sign of maceration is the skin slippage, that is seen 12 hours after intrauterine death. Loss of the epidermis exposes a red, shiny, moist dermal surface, especially noticeable over the bony prominences. So this is the picture of a maceration in a 5-month-old fetus. These are some of the gradings of maceration that you can see the reddish appearance onto the skin surface. 24 hours, you'll see fluid-filled bullae are formed between the dermis and the epidermis, that is skin left. After 48 hours, you'll see sweetish, disagreeable odor. Internal fetal organs and connective tissue show increasing purple discoloration due to hemolysis and breakdown of red cells. Dark red stained fluid accumulates in serous cavities and should be distinguished from serous effusions acquired at antemortem. Proteolytic digestion by Kallikrein contributes to vascular permeability. Color changes in the amniotic fluid. Deep dark red appearance, that is tobacco juice or meconium. A thick brown appearance is seen. Then the volume of the amniotic fluid increases following fetal death, and alpha fetoprotein also increases. Autolysis of the connective tissue is seen, that is elasticity of the bones. Body is soft, flaccid, and flattens out when placed on a level surface. Bones are flexible and readily detached from soft parts. Joints become abnormally mobile. Abdominal organs may show greenish discoloration. 3 to 4 days, you will see the fetal epidermis loses integrity. Umbilical cord is soft, red, and smooth. Fifth day, you will see subcutaneous edema up to 5 mm. For more than a week, you'll see meconium released into the abdominal cavity through the dissolving bowel wall. Protruding autolyzed liver mass produces an abnormal ultrasonographic appearance. Dystrophic calcification may develop in the autolyzed liver tissue. Fluid accumulation may mimic hydrops fetalis, the nape of the neck, and distortion of the skull occurs during vaginal delivery. Several weeks, you will see fading of the color to yellow or gray occurs. Progressive loss of the fluid from the fetus, that is formation of fetus papyraceous. Then the dehydration results in shrinkage and compaction of the tissues and organs. Extrauterine pregnancies may be retained for years, that is lithopedion. And rigor mortis may set in early stages of death. Presence of rigor mortis may cause difficulty in delivery. Mummification, it is the drying and the shriveling of the fetus occurring in uterus after death, results from liquor alumni results when liquor alumni is scanty and no air enters the uterus. Putrefaction, if the membranes are ruptured early and air enters the uterus, then the dead fetus shows signs of putrefaction instead of maceration. Then what are the radiological signs? The radiological sign of fetal death helps to diagnose intrauterine death in utero. We have the Robert sign. It is the earliest sign to appear. And what is Robert sign? There air in the aorta and pulmonary vessels and the abdomen will be seen. Then we have the Spalding sign that appears 2 days after death. It is the overlapping of the fetal skulls bones seen on X-ray or ultrasound due to shrinkage of the cerebrum after the intrauterine death. It may be positive in during or just prior to labor, scanty liquor alumni and diminished fetal vitality, microcephaly and craniostenosis. Okay. So you can see the overriding of the cranial bones. Now we have the dual halo sign, which is seen 3 days after death. Separation of the subcutaneous fat of the fetal skull from the cranial bones, seen as a halo on radiography and ultrasound. It was first described by Diol in 1947. Then other sign that you'll see is hyperflexion of the spine is more common. Crowding of the rib shows rib shadow with loss of normal pa- parallelism. Then we have something known as viability. So, what is viability? It is the physical ability of the fetus to lead a separate existence after birth, apart from its mother, by virtue of a certain degree of development, which depends on biological, physiological, and extrinsic factors. Legally, the age of the fetus is 210 days, that is 30 weeks of intrauterine life. At the age of viability, the pulmonary surfactant appears in the alveoli of the lungs and increases the surface tension of the alveoli, and alveoli becomes able to inflate. Okay, thank you.